We are honored to be joined by Robert Garrett, CEO of Hackensack Meridian Health, and the Harry Carson, Pro Football Hall of Famer, New York Giants captain, health ambassador for Hackensack Meridian Health. Number 53 is in the house, Bob Garrett.
I love it. I love it. It's welcome back to those glory days. Good to see you, Harry. Good to see you too, Steve.
All right. Good seeing you guys.
Harry, remind folks, what were those especially good years for us Giants fans that you gave us?
Well, the 70s weren't very good, but the 80s were more on the upbeat, especially 1986.
Yeah, we remember that. And by the way, HMH has a strong connection to the Giants. They're also a supporter of what we do at the Caucus Educational Corporation. Bob, let me ask you this. The role of Hackensack Meridian Health in vaccine awareness and distribution, could you describe it?
Yeah, first I wanted to say something about 1986, Steve, one of my favorite years because of the New York Giants. But I got to say it was the year I got married too, so I got to get that in for my wife.
Yeah,
too.
Laura would not appreciate it if you didn't do that.
She would not. So about the vaccine, Steve, the vaccine distribution is going well. It's getting better each and every day. I think it's fair to say it got off to a rocky start, but we are vaccinating at Hackensack Meridian now 3,000 people a day, 1,500 at our mega site at the Meadowlands Racetrack, and about 1,500 through 10 of our hospitals throughout Hackensack Meridian Health. We vaccinated since the beginning of the program, which was the middle of December, just about 125,000 people. New Jersey is about 15% of their entire population has now received at least the first vaccine. A long way to go, but certainly we're on the road. And, New Jersey's
Bob, stay right there. Bob, stay right there. We're taping on the 16th of February. When this is seen later, those numbers should be a lot better, right, Bob?
They should be a lot better. So we're at a pace where we're picking up 5 to 10% of the population each and every week. And, the New Jersey has a pretty ambitious goal, Steve. Our Commissioner of Health, Judy Persicelli, has set out a goal of vaccinating 70% of the adult population within 6 months. So we still got a ways to go, but I'm at least more encouraged now. The biggest obstacle is still getting the vaccine supply from the federal government. We have the 10 sites opened at the hospitals. We could open another 23 sites if we had more vaccine available, and that's really important because some of those sites are in community centers that are particularly important to some of our underserved communities in New Jersey. So I know we're doing everything we can. The governor, the commissioner, all of us are doing everything we can to get more vaccine supply for the state of New Jersey.
Well said. Harry, let me follow up with you. You dealt with COVID in March of 2020. This is a year later that we're doing this. Harry, you've been very vocal and working with HMH on this in terms of awareness in the African-American community and also as it relates to vaccine resistance. Talk about it specifically and directly.
In June, I went to a doctor and I got tested, and he said that I was exposed to the virus, but I had the antibodies and so forth. And so, I've always tried to be very careful and very disciplined in what I do. I was a football player, so I have to be disciplined to do certain things, but everybody is not like me. And what I try to do is share with people that this virus is real. I've experienced it, maybe not to the extent of other people. And when you find that people that you love, people that you've had a relationship with, experience having the virus and not recover and pass away, then it becomes more personal. And you want to make certain that you share with people, just be careful, keep your distance, wear a mask. You don't want to let your guard down in any way, shape, or form that you're going to infect someone else just because you don't want to wear a mask.
Let me follow up. Bob, how important is it that you and your colleagues are working directly with Harry and communicating directly to the African-American community? Harry is an icon. He's a role model. Why is that so important, Bob?
It is absolutely huge when Harry shares his story about getting COVID and what he went through. It means a lot because he connects with so many people. And, that means that, as Harry's message that you just heard, the message of being more careful about wearing masks, about social distancing and hand washing, but also as the vaccine started to roll out, Harry was on hand when we administered our first vaccines at Hackensack Meridian Health. And his message was a strong one. And that is, hey, I got COVID myself. You know what? You may be reticent, you may be hesitant about getting the vaccine, but getting COVID is a lot worse. And, and he's somebody I think that can really connect with so many New Jerseyans, particularly, those in the African American community. And we're trying to reach out in every which way we can through people like Harry Carson. We've also connected with church leaders and community leaders. We've filmed some public service announcements in Spanish and English to really reach out to some of the Spanish-speaking communities that we serve. And we've had some success. So the vaccine trials that we've been doing, we did a Moderna trial at Hackensack, and we're currently doing a J&J trial at Jersey Shore. We're getting a good response from some of those communities. Not as much as we'd like, but more and more coming in. And we're seeing, as the vaccine program rolls out, more people of color coming in to get the vaccines. But we're not, Steve, I want to say we're not where we should be. Those populations that are most vulnerable, we still have to get that message out there to them that getting the vaccine is important. And it's certainly way more preferable than getting COVID.
Harry, let me ask you this. Concisely, clearly, and compellingly, only the way you can, the message to those watching, particularly in the African-American community who may still be resistant, concerned, hesitating, you say what to them right now?
I understand why they're hesitant, but I also know that not getting the shot and possibly being infected, which might infect other people within your family, you need to get a shot. I got my shot almost 2 weeks ago. And, I went through the after effects and everything, but I want to encourage everybody to please, please, please don't play around with this. Don't try to play Russian roulette. Ensure yourself by getting a shot and then getting a follow-up shot, because my follow-up shot is in another 2 weeks. And I'm looking forward to that, to be able to continue to maintain distance and washing and all of that stuff. But at least, I know that I'm protected in some way. So it's better to be protected and then to go out and risk something happening and, you regret it.
Harry Carson, Bob Garrett, go Giants.
All right.
Thank you, gentlemen. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Northward Center, New Jersey Sharing Network, PSE&G, NJM Insurance Group, the Healthcare Foundation of New Jersey, the Turrell Fund, supporting Reimagine Childcare, PNC, Grow Up Great, Caldwell University, and by United Airlines. Promotional support provided by Meadowlands Chamber and by NorthJersey.com and Local IQ, part of the USA Today network.
Are you looking to be a part of a dynamic, forward-thinking business service organization? At the Meadowlands Chamber, every day we connect, collaborate, and innovate, helping to drive business and economic growth in the greater Meadowlands and New Jersey. I invite you to visit our Meadowlands Chamber headquarters, an open office facility with access to resources for our members' businesses and networking needs. Together, we will build the Chamber of the future and the next generation of leaders.